Good evening, Dr. G. Today is a big day. It's a culmination of the past 8 weeks of hard work, not only in the classroom, but also out in the internship field where I've been at. So the past 8 weeks, while I've been doing observations and studies related to physical therapy for individuals who have undergone joint replacements, I have observed behaviors and actions and really gotten to know how and why they operate. So my aim is to integrate these observations with established psychological principles and theories to better understand how we can enhance their recovery and overall well-being. This population specifically that I've decided to focus on includes men and women above 60 years old who have had joint replacements. This could be any joint, including the hip, knee, shoulder, wrist, or ankle. In my experience at a physical therapy clinic in Salt Lake City, Utah, most of my patients I see are post-operative, with only a rare being young adults. This observation underscores the need to tailor our approach to specific challenges faced by older adults recovering from joint replacement surgeries. The physical environment and the social environment are both important as they both significantly affect motivation, arousal, stress, and anxiety in patients. A well-designed workplace can enhance motivation by reducing distractions and promoting focus. This study was done by Weinberg in 2016. For instance, maintaining a calm and well-structured physical environment helps regulate arousal levels and prevents overstimulation, which can lead to stress. This was done by Jackson et al. In 2018. In our clinic, we have the temperature fair, typically what you would think of a room temperature, maybe on the colder end during the summer just because it's hot outside. Lots of natural lighting. Any artificial lighting we have is very dim, and we play soft music to create a soothing atmosphere conducive to recovery. The effects of stress, anxiety, and arousal. Stress and anxiety are influenced by various environmental factors. Crowded or noisy living and working conditions can increase feelings of stress and anxiety, while well-organized and calm spaces can reduce these feelings, promoting relaxation and control. Smith and Pollack 2020, Smith and Pollack 2020 is where I got this information from. Arousal levels, which refer to the state of being physiologically alert and responsive to stimuli, can also be influenced by factors such as noise levels, lighting, and overall ambience. This again, Jackson et al. 2018. A supportive and stable family environment tends to promote balanced arousal levels, whereas chaotic or stressful family situations can contribute to heightened arousal, anxiety, and even stress. Social environments, including interactions with family and peers, play a crucial role in the recovery process. Positive reinforcement and support from family members can significantly boost motivation, while negative interactions can have the opposite effect. Cultural factors within a family, such as values placed on health and wellness, further shape motivational levels. My observations indicate that interventions aimed at improving physical and social environments can effectively enhance motivation. There are often two types of patients in this group. The first includes those who remain closely associated with their family, which keeps them motivated and engaged. And the second type includes more isolated individuals who may struggle with motivation due to lack of social support. They could be isolated because they could be old, they could be a widow, their family could have moved. There's a lot of different factors that go into this. Addressing these differences is key to providing effective care. The need for feedback is essential for personal and professional growth. A supportive physical environment that facilitates communication can enhance the quality and frequency of feedback. Social environments that encourage open and constructive feedback contribute to better learning and performance outcomes. Family culture also plays a role, as families that value open communication and constructive criticism tend to foster individuals who are more receptive to feedback. As long as the patient is emotionally available for feedback, this can be crucial in aiding their recovery. The first step in goal setting is to establish a baseline. At the clinic, we begin by conducting a baseline assessment using the timed up and go test. This is also called the TUG test. Basically, what it is you Have the patient sit up under their own power, or excuse me, they're sitting in a chair and they go and stand up and they take however many steps it takes to travel a distance of 3 meters or 10 feet, and then they turn around, walk back the other direction, and then sit back in the chair. Typically, this test helps determine the current level of mobility and identify specific issues with walking or stair climbing. Based on this assessment, we can develop a daily exercise routine that includes strengthening major muscle groups in the legs and core, balance and coordination exercises, and gait training. These activities are personally measurable, allowing patients to track their process based on how they feel and their performance during exercises. To regain full range of motion, we start with an assessment of both active and passive range of motion. Following this, we create a stretching routine targeting knee extension and flexion, utilizing tools like towels or stretch straps to assist in bending and straightening the knee. Incorporating exercises such as heel slides and seated knee extensions helps stretch and strengthen the targeted area. Both of those are now the outcome goals. Now we will move to process goals. A key process goal for patients typically is to gain 2 to 5 weeks of flexion range of motion per week. So flexion, if this is your leg and my fingers are the toes, you will bend your knees. That's your flexion. Extension is, I'm going the other way. Extension is bending away from basically the glutes. Flexion is bending the knees back. So typical range of motion is if you're walking, climbing stairs, anything. Exercises. So each session begins with a 10 to 15 minute warm-up, including heat, gentle stretching, and light cardio, before moving into specific exercises. Exercises such as heel slides and quad extensions while sitting near a ledge are included. Manual therapy with a therapist to improve flexibility is also crucial. As exercise becomes easier, we add additional weight or increase the repetitions, all still while providing positive feedback as long as it is readily available to the patients. To lower tug test times, we set an initial test before we establish a baseline. Patients perform sit to stand exercises to improve lower body strength and transition speed. Walking drills focusing on speed and stability are also incorporated. Practicing the tug test weekly allows patients to monitor their progress as a positive way to see how they are improving. To continue on the goal setting, one performance goal is to complete all prescribed exercises given by a physical therapist within 1 month of starting therapy. This is like the general baseline that people want to work towards as they're still just coming out of surgery. Patients maintain an exercise log to daily track completion and their feelings during each exercise. Obviously, if an exercise hurts in week 2, then we will probably hold off until week 3 or 4 to try it again to see if they've made any progress that way. That's a good way to see their improvement that way. As they're doing better, we will gradually increase the number of repetitions and resistance while ensuring that they have adequate rest and recovery periods. The adequate rest helps prevent overtraining and injury, not wanting to go back down to stage 1 pre-surgery. Positive reinforcement and exercise adjustments help keep patients motivated and engaged. Another goal is to increase the walking distance without assistance. We start by measuring the current walking distance and set incremental goals to increase distance, pace, or total walking time. Daily walks, pushing close to the threshold but not going past it, help build endurance. Initially, patients may use canes or walkers, gradually reducing the reliance on them. Exercises like a stationary bike and elliptical training are also beneficial. Goal setting. Goal setting helps individuals identify what they want to achieve and outlines the necessary steps. It creates a roadmap that prioritizes effort and time, ensuring alignment and primary objectives. Smart, measurable, attainable, relevant, and time-bound goals, also known as SMART goals, boost motivation and provide a tangible reminder for what they are striving for. Research shows that goal setting significantly improves performance. Locke and Latham in 2002 found that setting specific and challenging goals lead to higher performance compared to easy or vague goals. This is due to enhanced focus, effort, and persistence with the goal clear setting. For example, you may have someone that just barely had the knee replacement. I use the knee because it's probably the most prevalent one that I see. You need the knee for everything. Squatting, picking something up, walking, stairs, anything. So typically you'll see a patient that wants to do their everyday lifestyle with minimal pain or without a cane or without a walker, just moving up and down stairs without a whole lot of assistance. This is a very smart, tangible goal. They can see it, they can feel it. You can put a time bound on it, say they want to be able to walk up and down the stairs without using a cane within 3 months of surgery. That may be a bit of stretch depending on the person, but some people do it. Helping clients set clear, attainable goals involves collaborating to define success and breaking down larger goals into manageable tasks. Continuous feedback, celebrating small victories, and offering constructive criticism to help maintain motivation. This was researched by Grant and Dweck in 2003. A supportive environment with resources, emotional support, and a network of peers, mentors, and coaches can significantly impact goal achievement. How this pertains back to the Bible and the devotion to the Bible. The Bible speaks of training and preparation for spiritual and physical endeavors. 1 Corinthians 9:24-27. PST interventions can help individuals prepare and perform at their best, fulfilling their God-given potential. Faith and values are central to living a purpose-driven life. Micah 6-8. Integrating these elements into sport and exercise psychology ensures that practices and interventions are ethically sound and aligned with deeper moral convictions. Theologically impact. Viewing PST as a form of stewardship of one's talents can encourage individuals to pursue excellence for the glory of God. Encouraging athletes and individuals to consider their faith and values in their pursuits help them stay grounded and purposeful, fostering a holistic sense of well-being and fulfillment. Additionally, the integration of faith values and ethics into sport and exercise psychology was a profound takeaway. It highlighted the significance of a holistic approach that considers not only the physical and mental aspects, but also the spiritual and ethical dimensions of performance and well-being. Moving forward, I am keen to apply these insights in real-world settings, helping individuals achieve their full potential while maintaining a balanced and purpose-driven life. To me, this course has been a very eye-opening experience that deepened my understanding of how psychological principles and theories impact physical activity and sport performance. One of the highlights was learning about the interplay between stress, anxiety, and arousal, and how these factors can significantly affect an athlete's performance. I found it fascinating to explore techniques like imagery and arousal regulation that can be applied to not only sports but also various life situations and enhance performance well-being. A focal point of my learning has been the importance of motivation and feedback in driving performance and engagement. Understanding different motivational styles and how to provide effective feedback has equipped me with valuable tools to support and inspire others in their physical development. That is all I have for today, and for this class, here's my reference. Dr. G, it's been a pleasure. I hope that I can one day in the near future have you as an in-person professor. Thank you.